the Beverly Hills Plastic Surgery Podcast. I'm here tonight via Zoom with one incredible Dr. J. Calvert. Dr. J. Calvert, how are you doing?
I've got to say that I am doing really well.
Yeah? Why so well?
Well, because I am training for this half marathon, which I think I'm going to be able to complete at this point. If you asked me a month ago, I'd say that there was a chance of death with that run. But at this point, I'm like, okay, I can get through it. Okay. So I'm pretty happy about that. On top of that, I think, it's been a good summer, I got to say. Good.
It has been.
Yeah, there's a good mix of getting a lot of work done, but also took some breaks. I mean, I'm all down.
Those are all good things. Lots of work, and vacation is always a good thing. I trained for a half marathon and I finished the training, but I never did the marathon.
Well, you should do it now then.
I made it all the way to the end of the training and I was like, yeah, I don't need to do that.
You got to get the medal. It's the key.
Maybe I'll join you. Maybe I'll pop in.
Yeah, why not? It's what you should do? If you take the bus, it's so much faster.
I would imagine.
Just get a car, get an Uber.
Idiots! Why are you running?
Totally. It's so much easier.
$125 for a bus pass.
There you go. But it's good. I'm happy, and I like our topic for this podcast. It's interesting that you brought it to me this way.
So the topic for today's podcast is FDA recommendations for screening your breast implants. And the impetus for this topic is actually a study that came out in our plastic surgery journal, Plastic and Reconstructive Surgery. And it came out this month, and it was an article that examines how often patients actually follow the FDA recommendations for screening implants. So I know that you were super anxious to jump in on this one. So let me just explain first. Let me explain something to you, and then you can have your say, okay?
I'm not going to say anything, but do you want me to answer the question of how often do they follow the FDA recommendations?
Okay, hold on. Let me explain it first. And then just hold on. Let me see my spiel.
Okay, I'm here.
Okay, so current FDA recommendations, and this is literally the spiel I give my patients. Current FDA recommendations are that you get some kind of screening test 5 years after placement. And that screening can either be an MRI or an ultrasound. Ultrasound was just added recently, a couple of years ago. It used to always be an MRI. If something abnormal shows up on the ultrasound, though, you do have to follow it up with an MRI. Then, once you've had your initial screening 5 years after placement, you're supposed to repeat that screening every 2 to 3 years thereafter. So that's the FDA recommendation. And I will give my version and opinion on it, but I know you are itching to respond. So, Dr. Calvert, what is your opinion on this recommendation? Be nice.
I'm going to be nice. I just don't think that, so I tell all my patients that. They say, well, how often do I have to have these checked? I say, you should come back and see me every year.
Yes.
I should do an exam. Yes. Right. So I say, you should come back and see me every year. And the implant companies recommend that you get an MRI every 3 years, basically once they're in, which is, that used to be the recommendation. And I still stick with that because that's what they've said. I can tell you that the patients follow those recommendations never. Hang on one second.
The article would say 5.9% of patients follow the recommendations.
What?
5.9. But
no chance.
But you're also looking at a blended population because you're bringing in the breast cancer patients who tend to be a little bit more prone to screening themselves because they are worried about recurrent cancers. They are seeing their doctors on a regular basis. Insurance is covering it because it's under the guise of reconstruction. So they are more likely to follow the recommendations than a cosmetic patient would be. So here's what 5%. I tell my patients. This is cosmetic and recon patients alike. I do my little spiel. I say,